Hi guys. Today we'll be talking about care of the patient with infectious respiratory problems, and these are covered in Chapter 31. Learning objectives. Applied knowledge of pathophysiology to assess patients with common respiratory infections that impair gas exchange. Prioritize evidence-based care for the patients with common infectious respiratory problems affecting gas exchange. Implement nursing interventions to help the patient and family cope with respiratory infections. Teach the patient and caregivers about common medicines used for pneumonia, tuberculosis, and other respiratory infections. Teach adults how to decrease the risk of respiratory infections. Okay, so the first thing we're going to cover is seasonal influenza. So the fast facts on it is that seasonal influenza is highly contagious. It is a viral respiratory infection. It can occur at any age. 5 to 20% of the U.S. population get influenza each year. Just so you know, you are contagious 24 hours before symptoms and up to 5 days after they begin. There are different strains, and strain B can cause nausea and vomiting. Seasonal influenza, both signs and symptoms. Onset is rapid. Most common is severe headache, muscle aches, fever and chills, fatigue, and weakness. So unlike the common cold, which kind of comes on more slowly, and you may have a couple of muscle aches, you generally do not have a fever, and you really don't have fatigue or weakness, you just have a runny nose and not feeling well. So seasonal influenza, signs and symptoms, least common. Sore throat, cough, watery nasal discharge. Again, with rhinitis or the common cold, you do have watery nasal discharge. So, seasonal influenza, signs and symptoms. The onset is rapid. Most common is severe headache, muscle aches, fever and chills, weakness, and fatigue. Less common, sore throat, cough, and watery nasal discharge. Complications with the seasonal flu include pneumonia and death. These complications are more likely to occur in the elderly and those that are immunocompromised. Seasonal influenza treatment. Symptom control. Rest, increase your fluid intake, self-quarantine to avoid spread. Make sure you're using good hand hygiene and cough into your elbow. Sometimes antivirals are ordered, but they must be taken 24 to 48 hours after symptoms begin. And this is especially important for the elderly and the immunocompromised. So when you have someone who is elderly or immunocompromised who is showing signs and symptoms of the flu, it's essential that we get them treatment with the antivirals. So these are all things that we all know. The seasonal influenza prevention. Seasonal influenza vaccine. Should be over 50, the immunocompromised, people who live in groups such as in dormitories or prisons or nursing homes, or those of us who work in healthcare. Other ways of preventing is hand hygiene and coughing into your elbow. Pandemic respiratory infections. A history. The Spanish influenza, over 40 million dead worldwide. And some of you may remember the H1N1 swine flu of 2009. It affected 215 countries, including the U.S., and is now part of the annual flu vaccine. When this occurred, we had to be revaccinated, and we had to relimit. Usually during flu season, visitors for the hospital are limited, but back in 2009, we had already come off of our normal flu precaution time, and they had to restart it because of the H1N1 influenza. So again, that was in 2009, and now H1N1 is now part of the annual flu vaccine here in the U.S. Pandemic respiratory infections. Sorry, guys, I tried to get it right, but I couldn't. But anyways, this is pandemic respiratory infections that we have a potential for. H5N1 is the bird flu, and it's seen mostly in Asia. It has not been seen here in the United States. And I was curious, since the copyright of our book is 2016, has it been seen in the U.S. since? I looked on the CDC website on Friday, and it has not been seen here in the United States. What's interesting is there is a vaccine available, but it is not part of our seasonal vaccine because it has not been seen here in the United States. Prevention is very similar to what we see right now with COVID-19. As far as limiting public events, taking care of the people who have it in a cohort, and making sure that limiting public activities. Now, Middle East respiratory syndrome, or MERS, is part of the coronavirus family. It's mostly seen in the Middle East and Asia. Only 2 cases in North America, according to the CDC, have ever been here in North America as of August 2019. When discussing the pandemic respiratory infections with Dr. Hudson, I said, I feel like we're not mentioning the elephant in the room, so to speak, because we are not talking about COVID-19. And I agreed with him when he said that the reason we're not teaching about COVID-19 is because so much is not known. And we know that it won't be covered on your NCLEX because the research is still ongoing. So we're not going to worry about that. Just know that prevention for H5N1 is very similar to the preventions that we're seeing in place now for COVID-19. I hope that makes sense. So just a brief review for your influenzas is that we make sure that people who need to get their vaccines, that's over 50, communal living, healthcare workers, we make sure that we wash our hands, that we cough into our elbow, and that symptoms for influenza are rapid onset. And so we're going to stop this slide a little early so that we can keep pneumonia all together.